Good morning, everybody. New South Wales residents came out in force yesterday again for testing 119,000 tests done to 8 p.m. last night, and we really want to encourage people to keep coming out for testing. It's very encouraging to know our citizens are listening to the health advice and coming out and getting tested with the mildest of symptoms, or if they're a particular worker and they've been asked to get tested, people are doing that. We had 344 cases to 8 p.m. last night of community transmission. Around at least 65 of those were infectious in the community for all or most of their infectious period. I do want to stress that, as we know, the last 2 days we have seen a surge in the number of cases, and we expect that to continue. But positively, we are starting to see a decline in cases in the Fairfield local government area, but also in the Canterbury-Bankstown local government area. And while the number of cases, especially in Canterbury-Bankstown, are still high, we are starting to see a decline. So that intensive work we've been doing in those areas is starting to have effect, and we ask the community to keep at it, to keep going, and to make sure you stick to the rules. Regrettably, there were 2 deaths overnight because of the Delta strain. A man in his 90s who died in hospital, unfortunately, again unvaccinated, and heartfelt condolences to him and his family, for his family. We can't imagine what it's like to lose a loved one under these circumstances. And unfortunately, a man in his 30s also died in hospital. Again, our heartfelt condolences and sympathies to his family and friends. We do want to stress that the man in his 30s did have other conditions as well, but notwithstanding that, he obviously succumbed to COVID. As I mentioned, we are starting to see cases decline in both the Fairfield local government area but also the Canterbury-Bankstown local government area, which is a positive sign. In Canterbury-Bankstown, the case numbers are still the highest of any local government area, but we're starting to see a trend that we've seen in the last few days, and we know the intensified efforts we're doing in those areas are starting to bear fruit. However, the adjoining local government areas, or the suburbs adjoining those areas of Bayside, Burwood and the Inner West, are starting to have an increase in cases. So they're not at high levels yet, but we don't want them to get higher. So please note that if you live in those suburbs around the Bayside, Burwood and Inner West councils, please be on extra alert, come forward for testing. We don't want to have to include you in those local government areas of concern, but we might have to if case numbers don't at least stabilise or start going down. So we're at a stage there now where those decisions will be provided by the health experts in the next few days if we don't see a decline in those 3 local government areas, especially in those parts that are abutting those other local government areas of concern. In the regions, Armidale still has no extra cases, Tamworth still has no extra cases, the Northern Rivers still has no extra cases, which are all positive signs. Unfortunately, in the Hunter, New England area, there were, I believe, around 14 new cases overnight. So Hunter does not look like it'll come out of lockdown later this week. However, we'll await the health advice. But just to know that whilst the first 3 local government areas that I mentioned don't have any additional cases and things are looking very positive, Hunter, New England, unfortunately, isn't looking as positive. And as has been foreshadowed, in Dubbo there were 2 cases overnight, and that follows, which is really important to note, our health experts had told us a few days ago there was some sewage detection in Dubbo, yet we didn't have any cases. So sewage detection has been a good way of identifying or preempting where there may be cases, and after intensive testing and activity, 2 cases have been identified, and therefore from 1 p.m. today Dubbo will go into a 1-week lockdown, and I understand community leaders and various organisations have already been advised of that, and that will occur from 1 p.m. today. Can I please again, my final message today is the message that Dr. Chant, myself, the Minister and all of us have been talking about is please come forward and get vaccinated. We have passed the 4.5 million jabs. We have a target of 6 million jabs by the end of August, and I do want to foreshadow that as per the Doherty report, 2 doses of 70% vaccination, New South Wales will hit, if we keep the current pace, we hit that around the end of October, and we hit 80% double doses towards the middle of November. Now, according to the Doherty report, that's when life looks like getting back to normal. That's when we have a different approach to COVID. That's when the freedoms that we had before this outbreak are certainly going to be in place, and where we can look forward to having a normal existence. But the challenge for us is obviously how we live in September and October until we get to that double 70%. And with 6 million jabs by the end of August, if we achieve that, there will be opportunities for us in some parts of the community where case numbers are low and vaccination rates are high to allow people to do more than what they do today. And that is something we are working towards, and something that our government is very keen to make possible. So I really want to encourage people to come forward and get tested. I know that some people have been frustrated in the last week in particular, where we've seen an increase in demand in vaccination, where people want to be able to book more efficiently and want to get their jab more quickly. Please know that we're really working hard to provide more walk-in opportunities, more pop-up clinics, and making sure we get advice to the community. So please know that that is an absolute priority for us, because in addition to the strict rules we have about what people can and can't do, the strict lockdown we have in place, vaccines are really key in reducing the spread, but also allowing us to get to those rates where we can consider easing some of what people are having to go through now during September and October. And that will be the most challenging couple of months for New South Wales. How we live until we get to the 70% vaccination, double dose vaccination rate. But can I also stress this point? Myself, the Minister, Dr. Chan, every single member of our government is committed to reducing the case numbers as much as we can. Please know that is always our intention. We know what works and what doesn't work. We're learning as the weeks go by. And we really want to encourage everybody, please stick to the rules. Please know that when people do as they're asked, the results are there. It's just a handful of people doing the wrong thing that really causes grief for everybody, that causes setbacks. I know that the police and health are working together, even until last night and during the day today, to see what further we can do in relation to compliance. Because we know that a strong police presence, the ADF support that's on the ground is making a difference, and we want to make sure we capture those handful of people that continually do the wrong thing. So again, our appreciation that people are continuing to get tested, keep getting vaccinated. If we keep this vaccination rate up, we will get to 6 million jabs by the end of August, and that will give us some opportunities to think about what additional freedoms we can give people in September and October. But clearly, looking forward to that double dose of 70% vaccination, because that's when, according to the best advice we have in the Doherty report, we can start to live life freely and not have the strong restrictions we have in place today. So now I'll ask Dr. Chant to give her health update, and then we'll take any questions. Thank you.
Thank you, Premier. So there were 344 locally acquired cases of COVID reported in New South Wales to 24 hours to 8 p.m. and there were no overseas cases reported. 119,256 tests. There are 62 cases in ICU, and again, are quite a young profile. 3 in their 20s, 7 in their 30s, 6 in their 40s, 14 are in their 50s, 13 are in their 60s, 16 are in their 70s, and 3 are in their 80s. It is also important to know that 57 people in ICU, 57 of that 62 are not vaccinated, and 5 people have received 1 dose of the vaccine. So you can see that the vaccine works. We haven't got anyone in ICU that has received the 2 doses of the vaccine, and even the pattern, we would have expected, proportionate to vaccination status, those people not to be in ICU with the one dose. So even one dose does afford protection. In terms of the deaths, sadly we've had the 2 deaths, and as the Premier has indicated, there's a gentleman in his 30s from Northern Sydney who died in the Northern Beaches Hospital yesterday. He was not vaccinated, but had some significant underlying health conditions, and also a man in his 90s from southwestern Sydney died at Concord Hospital. And can I just pass on my sincere condolences and sympathies to their loved ones. In terms of the key messages for today, it is to mirror what the Premier has said. We are seeing some pleasing improvements in Fairfield and some stabilisation in Canterbury Bankstown. It takes a while, but it does show that with that strong community response, with everyone working together, we can actually stabilise and turn around an uptick in cases, an upswing, and bring that down. But what we are seeing is the growth of case numbers in other areas, and we need to redouble our efforts in those areas to achieve the same impact that we've seen in the Fairfield area in particular. So for instance, the inner west, the areas around Cumberland are still very high, Bayside, Georges River, particularly the edges of those suburbs that border onto the affected suburbs, and Strathfield as well. And as the Premier's indicated, we're watching those closely. So it is important that everyone knows that there is an increase in cases in those areas, and for them to come out and get tested and assist us with control. In terms of the Hunter cases, yes, there were 14 new cases across Hunter, New England. The majority of those cases are linked, but some are still unlinked, and those unlinked cases are the ones that concern us most. Central Coast has already also reported 2 new cases, and they're still under investigation, but preliminary assessment does indicate that both of those cases travel outside the Central Coast, and so preliminary information is that they probably acquired their infection outside the Central Coast. But again, we ask the Central Coast community to be very vigilant and come forward for testing. In relation to Dubbo, there is 2 confirmed cases that came in, a lady in her 40s and a household contact, a young child, and because of those cases, we've recommended a lockdown which the government has put into a place. It is critical that that lockdown is complied with in Dubbo, and even though it comes into at 1 o'clock today, we are asking people to make those decisions and act in a way as if it is in place at the moment. Also, we would like to see increased testing opportunities, and locally those testing opportunities have been stood up. Thank you.
Premier, yesterday Dr. Charp made it very clear at the inquiry that a 70% vaccine threshold would need to be achieved before we see some level of easing of restrictions. Why do you keep on insisting that 50% could be enough to ease some restrictions?
Can I just say, Dr. Chant and I have been absolutely aligned on this issue. The Doherty report says that if you want significant freedoms, you need 70% of your population fully vaccinated, and we've made it very clear from the outset that the New South Wales government in fact commends and supports the findings of the Doherty Institute, and that we intend to implement our policies in that regard. However, we are currently in lockdown, and if during September and October we have higher rates of vaccination and certain communities indicate lower number of cases, there are opportunities for us to see what additional freedoms we give people. Does it mean we will live like we did before the outbreak? No. But what it does mean is that people will be able to do more than what they can today. And these are the issues and opportunities we're discussing with our health experts to see what are low-risk areas that we can ask people who've been vaccinated to undertake freely in September and October. So please know that they are 2 very different things. So of course, all of us strongly support 70% double vaccination as the point in time by which we start living life like we used to before the outbreak. And of course, once you get, and then between 70 and 80%, there's a transition. Once you hit 80% of double vaccination, what that means is that no longer do we focus on the number of cases, we focus on the number of hospitalisations, because when you have such high rates of vaccination, people can not only live more freely, but we can focus on keeping people out of hospital as opposed to counting the cases. And as Dr. Chan and other health experts have said, you transition then to a stage where you regard COVID as more like the flu as opposed to a sinister virus which is taking and threatening human life.
So it's no longer end of August, it's now looking at September and October.
No.
Is that August target now
No.
in the water?
No, can I just please, I'm not sure if people aren't listening to what I'm saying, but what the end of August means is if we have 6 million jabs, it gives us opportunities to think about how we can ease some restrictions that we currently have for people who live in communities with lower case numbers but high rates of vaccination. There are significant communities in Greater Sydney that are in that situation. But it does mean having careful thought to what are regarded as low risk, because we certainly don't want to increase the spread, we want to see case numbers go down. But that's a very different proposition to what life looks like at 70%. When 70% double dose vaccinations are there, it means you have more confidence that more and more people will be kept out of hospital. We can ease the strict restrictions we have in place today. So please note that there are 2 very different things. Lockdown now plus some opportunities to live life differently in September and October is very different to what life looks like when we get to 70%, and I want to be very clear about that. Please know, for example, we've noticed in the last few days a huge demand for people who want to get back to work in those local government areas, for example in the construction sector, coming forward and getting vaccinated, and we want to thank them for that. People who previously may have thought, oh, I don't really need to get vaccinated now, I can wait, and now seeing are incentivised. If it means getting back to work, people are incentivised to come forward and get the vaccine. So that's why I'm really calling out to everybody to saying, please get vaccinated, because there could be opportunities, there will be opportunities in September and October for us to be able to say to the community, if you are vaccinated, you might be able to do a certain level of activity which you can't do now. And they're conversations we're starting to have, and they are conversations which will be based on their health advice, low risk activities where if people are vaccinated, they can go out and do. And it's an important way for us to send the strong message that vaccination prevents people going into hospital, it reduces the spread, and it gives us the chance to have people live a little bit more freely than what they're living today. But make no mistake, the 70% double dose, as the Doherty report says, which we accepted, which I strongly support, is when life will look very different to what it does today. And that is the bottom line.
Premier Dr. Chan said yesterday that at the 50% vaccination target, any changes would be very minimal. So are you giving people false hope by suggesting that some restrictions would ease in September and October?
I think it's important to say to people that if we have higher rates of vaccination, there is every chance you might be able to do something more than what you can today. And I think for most people that is incentive. We've seen how the incentive of getting back to work in the last few days has really ignited people to get vaccinated. Those incentives work. And if we can incentivise people to say that if you're fully vaccinated, you might be able to undertake activity which you can't now, well, that's a positive, and I think most people would appreciate that. September and October will be the most challenging months for us in terms of public policy, in terms of how we move forward, because we wouldn't have reached the 70%, but yet we would have increased vaccination rates, and some parts of Greater Sydney are demonstrating quite lower numbers of cases. But rather than speak on her behalf, I'm happy for Dr. Chant to make comment on this as well.
So the Premier has asked us for things that are very low risk that we potentially could look at. And also we know that at the moment the disease is differentially spread, and that may change, and that's what we're really working with communities to stop happening. But we do know the risk profile in different communities is different, and it may be that we can do some things in some areas where they haven't seen any cases if that situation remains in place. So the Premier has just asked us to provide advice on what would be low risk activities. Obviously I'm currently concerned about our case numbers, and my focus is on seeing those case numbers get as low as possible. And I think whilst the Premier is providing that as what will happen after August, my total focus and that of our team is working to drive these numbers down, and we need to have the community on board, and we need to have that community responding if we are going to prevent any further escalation of the numbers.
Dr. Chan, from a health messaging perspective, do you think it's perhaps a bit confusing for the community, and maybe playing into why people aren't complying with the orders and taking it as seriously as they need to, that we have these sort of different goalposts? It's 50% by August, 70% later, but people are not understanding how serious it might be if they're hearing that we could be getting easing of restrictions by the 28th of August, as it's been indicated.
I think the community understands the situation we're currently in, and every day when I read out those numbers of people in ICU, I think it resonates with the community. And the fact that they're young people in ICU, I think the community understands the significance of what challenge we're facing, and it is a significant challenge. I think also it's important to take the community on board with us in terms of what the future will look like. And even from many months ago, the Premier and I have been speaking about what the future looks like and the role of vaccination, and how we'll get, what will be the future with COVID. And I think even from a long time ago, we've said at some point we will need to learn to live with COVID.
Have you seen bleeds from the hotspot LGAs into other LGAs? Doesn't it make more sense now just to have a blanket approach across Sydney, maybe even just metropolitan Sydney, same rules apply so we don't see this continued bleeding maybe 2 weeks ahead?
So the restrictions in the, clearly we've got very tough restrictions across all of Greater Sydney. What the LGAs of concern, the elements of that that's been useful is one is really calling out those risks, and I think what we've also seen is the community responds when we actually tell them specifically areas. It's very hard for the community if we are talking about cases in an area where there's been no cases, whereas if we can explain that these are the areas where we're seeing cases, we get a greater response.
But I don't think
Also,
anyone's under any impression that this isn't serious. And you've got Shell Harbour still locked down, there's been no cases there. So my common sense, I'm just saying from a common sense perspective, and tell me if I'm wrong, because the problem, why not just blanket?
So some of the things that go along with being local government areas of risk are testing advice. So for instance, we initially targeted Fairfield local government area, and then in terms of Cumberland, we switched that. So there are some elements within it that actually keep us, we can't have everyone, every time you leave an LGA, get tested because we don't have enough lab capacity. So there are some elements of the response by identifying these local government areas of concern that allow us to target, and really target also police resources, because in the end we know that working actively, I think the challenge for us is to be ahead of the spread and make sure we've got that preventative action in the communities where the spread is going into. And you've seen that preemptively we put in part on the weekend Penrith, when we started to see those case numbers go up, and we were predicting that. And again, the Premier has flagged today that we've got a number of suburbs on watch, and they may well be put into it. It's about getting ahead of it and making sure that we put that preventative action in place.
Dr. Chan, is there any indication where the Dubbo cases got that, where the source?
No. So at the moment, the two cases in Dubbo are in one household. The source of that investigation is underway, and we really need an incredible community response. We know that the community has been responding to testing, but we need to redouble our efforts so that we can identify that source.
Dr. Chan, can I just ask you about, ask you yesterday about delays in getting to employers who have positive cases in their workplaces? We've been contacted by a removalist who said he had someone test positive on Sunday, rang New South Wales Health, told, don't ring us, we'll ring you, and he's still on Wednesday not being contacted by New South Wales Health. He's sleeping in his warehouse because he's too frightened to go home.
Well, if you provide me with those details, I'd be very happy to arrange a case to follow that up. I mean, clearly that's not optimum ideal. I can't really comment until I know the circumstances of what has occurred in that state, but I'd certainly be keen to follow that up.
Dr. Chair, three people turned up at a vaccine clinic in Albury today from Sydney. That's still legal for people to travel from Sydney to the regions or vice versa for a vaccine and not isolate on return. Are these loopholes that we should be closing?
Look, I think that there has been an exception for people that, for instance, live in the intent of the exemption is really around people coming in where you're border. Like if you live in Bowral and you need to come into Campbelltown for your vaccine. So that was the purpose and intent of allowing that. I'm just appalled that people would think at this point in time that that's okay. And also it's taking vaccines off people in Albury, which I also don't agree with. And there is plenty of access to vaccine in Sydney, and I don't see that that's a reasonable reason to travel many hours for that. So again, if you can provide the details of that, I'd be happy to get police to follow up with that case.
Dr. Chair, is there any indication that the case numbers that we are seeing now have stemmed from the protest that we saw a couple of weeks ago?
Look, it's very difficult because we do rely on people to tell us whether they were at the protest and other aspects, and that's really impossible when people look, our contact tracers really try and extract as much information from people, and can I just say that is why I stand up here every day trying to appreciate people's cooperation. Part of me gets very frustrated at what people have done, but our focus at that point in time is really to find out where they've been, who they've been in contact with, and any other issues are dealt with separately. So just to reassure people, health takes that approach, but it doesn't mean that it doesn't cause me great frustration and anger that people have chosen to do the wrong thing at such a challenging time.
Maybe just giving people hope that when we get to 6 million jabs delivered, we can have some additional freedom in places with high vaccination rates and low cases. All of those decisions will be based on advice that you provide. So can you give us some certainty about what additional freedoms we will be able to see in circumstances of high vaccination and low cases when we get to 6 million jabs if case numbers don't come down?
Well, we're in a situation where we're in the 10th of August at the moment. That's a long way away from the 31st of August, so the situation can change rapidly. I'm still, and that of my team and New South Wales Health and whole of government, is still committed to see those numbers driving down, and we also don't want to see the spread of the virus further. But we are looking at things like, when people are fully vaccinated, is there any opportunity to do certain activities? We will provide advice on what are low risk things that could occur, and I will provide that advice to the Premier.
Can you give us some more details about that?
A case in Nowra. I haven't been advised about a case in Nowra. A Shell Harbour. So there's a case in Shell Harbour, and that case has tested positive, and that case does have links. The person works in Greater Sydney and travels down to Shell Harbour. The person's household, who lives in a disconnected household, is being tested as a precaution, and the contact tracing is occurring. But my understanding is that gentleman largely worked from home, but did have activities for work where he travelled into Greater Sydney.
The Pearson Hospital has obviously got a number of cases in the mental health ward. Can you clarify how many cases there are, and also can you tell us about the staffing crisis? Because we're hearing that staff have been told, even if you are in close contact, you still need to come to work.
Thanks, Lizzie. Look, I obviously heard about that too. So I spoke to the infectious diseases specialist in that Nepean Blue Mountains Local Health District. I also spoke to the operations manager. What I understand happened was that a patient came into, there's a dedicated mental health unit at Nepean Hospital, about 30 patients normally, and the staff who are there are highly trained mental health staff. A lady obviously came in, I think it was on the 4th of August, and she had obviously very disconnected thought processes. 2 days later she became febrile, so had a temperature, and was given a COVID test, returned positive. The staff then were obviously asked, they were looking at how many were vaccinated, how many weren't. Actually about 70-odd% I believe of the staff, and I thank the staff for that. About 70-odd% of the staff in that ward are double vaccinated, so that's fantastic. But there are pressures, no question, because they can't draw staff from just the general wards. These are highly trained mental health staff. And so the discussion took place with the infectious diseases specialist, and the concern was that the patients were all moving back and forth, obviously, in the ward, and the nature of their mental health disordered thought processes was such that there had to be a decision as to which was the balancing act here. So the balancing act the infectious diseases specialist determined was appropriate was that staff be asked to wear full PPE during the rest of their shift, and that's what occurred. No staff have been positive. I have to say though that I think that it remains a big challenge, because talking to it's one of the issues. I think you were here yesterday. We were talking about whether or not we need to go down the path of mandating hospital staff to have vaccines. And I know there's still reluctance in some quarters, as I said yesterday, but my view is they do have to be, because we have these situations arising more and more, and I think that the advice I'm getting from the infectious diseases specialists is that the hospitals are becoming more and more of a challenge, because patients are obviously coming in with COVID as it's broadly through the community. Sorry, do you mind?
Sorry.
So I think at this stage, the staff that are there are very challenged, and I want to thank them, because what I'm told is that this morning there were quite a number of staff who were going to come from another hospital who rang in sick, and doubtless that's because they have, either they're very sick or they have fears of going into that particular unit. And I think that's one of the problems we're facing now. How do we actually manage that that health situation and the increasing pressure on the hospital? But I want to thank the staff. Hang on 2 seconds, sorry. So I want to thank the staff who are there working, but no staff are positive. It may be though that we'll have more patients that are positive because they're all interchanging. Can I come to you in a second because Ursula had her hand up first. Ursula.
Minister, there was a health worker that was punched in the face, a COVID testing tube by a member of the public. What do you make of that, and what did that man face?
I haven't actually heard of that, but let me say I have had health staff tell me that at various stages there have been people who have behaved absolutely abhorrently to our frontline health staff and have assaulted them. My message to them is we're in the middle of a pandemic. Those people are there, well trained, very caring to look after you. Any assaults like that, I'm quite sure the police will bring down the full force of the law, and so they should.
Minister Hazzard, yesterday you told the inquiry that you
Sorry, can I deal with you first, then I'll come to you.
Yesterday you told the inquiry that you believe in regards to the 50% vaccination rate, that perhaps when the Premier said it, she was trying to provide some hope. Do you still believe that this sort of a statement is a statement of hope, or do you believe it's a fact?
It's both. It's a what the health staff and we are looking at, and I was just in meetings this morning again. I think sometimes the assumption is that we do these things in a static moment and just come up with something and come down here. We don't. We work very hard all day, and we're looking at what other options could there be, and there's different people, not just Dr. Chant. As I've said many times, she's a whole team. So we're talking about if we can get to a certain point, and obviously the Premier has highlighted that hopefully when we get to about 50%, we might be able to find ways to ease the pressure in some communities. There are some communities, as the Premier has said, that have very, very high rates of double vaccination. There are others, sadly, and in some areas we'd really love them to be like that, double vaccinated, but they haven't made it there yet for a variety of reasons. Sometimes it's because of a lack of vaccines, sometimes it's a lack of understanding of the value of the vaccines, sometimes it's just a distrust, and we need to work and continue to work very hard to try and convince those people to get vaccinated, and I'm sure that there will be measures that we can take that will ease us back into, as the Premier said, later this year when hopefully we'll have a far better life. Just, James, can I go, because I think somebody wanted to ask the Deputy Commissioner, and then I'm happy to come back in a minute. Deputy Commissioner?
Ask you about that incident where the worker was assaulted.
Yeah, that incident occurred at Kissing Point Road at Dundas at a testing site there, where police will allege a man came up to one of the workers just going about her tasks, pushed the telephone into her face, dislodged her mask, then struck her in the face, said some horrible things, and then left the scene as others come to help that lady. What I can say, which is very pleasing as a result of information that has been received, that there is a man right at this moment at his local police station assisting police with the inquiries. The behaviour is totally unacceptable. No one would say that there is any reason to behave like that to any person, let alone someone that is out there every single day helping us to get through what is a very challenging situation with the pandemic.
Deputy Commissioner, given regional
Certainly.
How are you going with your investigations into the Manitoba?
Yeah, I spoke to the police up at Northern, at Newcastle. They are continuing to conduct their inquiries. Of course, as we always say, the main thing is that New South Wales Health get the information that they need to go on in terms of contact tracing. But the police up there are very confident as they move through the inquiries that they're making around that man coming from Sydney and being in Byron Bay for that period of time, that they're well advanced, and we would hope to have something very soon where they might be able to go and speak to that gentleman. Sorry, James. Yeah, that's one of the avenues of inquiry, and of course I refer back to the question about the testing at Albury. People who step well beyond the orders. If someone is going to look at a piece of real estate, however, there is
the appointments that are made, the time that's taken. There's a whole range of things that police can investigate to see whether that journey was bona fide in terms of its reasonableness, in terms of the orders. So that will form part of the investigation for sure.
Given regional towns are going into lockdown in a domino effect, can we beef up the fines for people who are intentionally, recklessly travelling against the orders? Obviously there's so much at stake here. It could cripple businesses, it could kill people. Surely that's a level of aggravation of the highest degree.
Look, I think when we've seen people in these country communities devastated by people travelling from Greater Sydney out into the regional and rural areas. Police have issued any amount of infringement notices. $1,000 on-the-spot penalty is a considerable penalty for some, or for many of us, to endure. But of course, people can also be put before the courts. That's the minimum that can happen. And police will always look at what is the best outcome and what the community expect how people should be dealt with. Sorry?
On the singles button, how do police verify that the person who's visiting another house is in fact the nominated person who's allowed to be there?
Again, I would say that we get 1,000 calls to Crime Stoppers every single day, people providing us with information that kicks off an investigation. An investigation is exactly that. They would go and ask those people about how they came to be there, when did that singles bobble start, why did it start. Police will satisfy themselves that that singles bobble arrangement is in fact within the order. If it's not, police will take action and let other people decide in terms of the reasonableness of that action.
Premier, is it fair to say before the end of August nothing's going to change significantly?
Oh, well, we've always said the current the current restrictions in place will be there at least until the 28th of August.
If that's the case,
but can I just
why
also...
is the moratorium on rental evictions in commercial premises running out in 7 days?
Look, I'll have to speak to my colleagues in relation to that, but I understand measures are being put in place to make sure that support exists until at least the end of August. But can I say at any stage, we rely on the health advice. If there's extra areas of concern, if there's opportunities for us to do more, we're always looking at those opportunities. But suffice to say, nothing will be eased at all before the 28th of August. So if I could make that very clear.
But just on the business side of it, because people are screaming at us, I'm sure they're screaming at you too, but at the moment there's real frustration and pain. I spoke to a lady today who has to sell her house next week because she can't pay the rent that the landlords are demanding from her because you haven't instituted the national code yet. Why not?
Well, can I get advice on that? I know that our Cabinet colleagues have been working hard in relation to those matters, and I will get advice from them.
One of the issues, though, Premier, because obviously you're working really hard to get the health aspect under control. Is that just taking up so much of your time that you're almost ignoring the economics of it?
Not at all. And can I say that we worked really hard and continue to work hard. If you look at what the Work Service New South Wales is doing, I would suggest at least half their energy is going towards providing extra support to businesses to get those grants, to get those dollars out the door. And I'm advised that by the end of next week at the very latest, the backlog will be dealt with. And I appreciate how frustrating it has been for businesses. I want to thank Service New South Wales, but also obviously Services Australia that are providing the disaster payments. But I also want to thank external parties like banks, who I understand have instituted particular policies to support their customers during this difficult time. All of us appreciate the stresses everybody is going through, but please know that we've always taken a very balanced approach in New South Wales to make sure the economic support is there so that people don't feel they've got to breach the health orders, they don't feel they have to do anything or leave their home unless it's absolutely necessary. And on that front, can I also say that in those local government areas of concern, there has been additional support directly to households over and above those payments that we've been speaking about through non-government organisations, through multicultural communities, on the ground charitable organisations. So the New South Wales government has also provided an extra millions of dollars of support through direct assistance in those areas of concern in particular. And to make sure communities are supported. So please know that we are working really hard, not only in relation to obviously reducing the case numbers, which is our absolute priority, and can I stress that a million times over, We are working overtime to get those case numbers down, but equally working hard to ensure that people receive the economic support they need, but also that the wheels of government are turning in relation to everything, because all of us know that we will get out of this, and we want to make sure that we do it in the safest possible way, in the best way that brings our community forward together, and also which takes everything into consideration, mental health in particular, which is very critical, mental health, our economic needs, our employment needs, as well as, of course, the health needs of the community. We always put, in a pandemic, you have no option but to put health and safety first, but it certainly doesn't mean you let other things fall by the wayside. Quite the opposite. You make sure that you're providing that economic support. And can I in particular thank everybody at Service New South Wales who's working overtime to address those backlog issues. There are thousands and thousands of applications they've processed and will continue to process. I apologise to those to people and businesses who have experienced some delay. I really do, because I can only imagine how stressful it would be to await a payment which you're relying on to keep your business going. But please know that relief is there, and please also know that every member of my government is working hard in their patch. So whether it's providing support to tenants or landlords or every other category in society, we are the only government that has ever, during a pandemic, for example, provided support to micro businesses, to sole traders. So we're covering every single base. Whenever there's a gap that's highlighted, we're working fast and hard and quickly to try and cover that hole. So there's no doubt that, as Dr. Chan always says, even though she's the Chief Medical Officer, what we're doing in response to the pandemic is a whole of government approach. It involves getting the balance right with the economy, with supporting businesses and individuals, with our police efforts. It is a whole of government approach, and that's how we continue to support our community.
There are tens of thousands of parents trying to homeschool and work from home. When are you going to provide a roadmap on return to school? And we're also hearing that some schools are cancelling their trial exams. They're not able to do them online. Do you have a view about that?
Oh, well, the Education Department and Health have been working very closely in relation to allowing schools to conduct the trial examinations in a safe way. And of course, we support that initiative. And I want to stress that even though this is an incredibly stressful time for our Year 12 students, we're working really hard to make sure they have every support when they're achieving their HSC. We're making sure that when they sit for their exams in October, it'll be a safe environment with obviously all those safety measures that Dr. Chan is advocating to make sure they sit their examinations in a safe way. And that is one of our absolute priorities. In relation to education and schools, there are ongoing discussions that our government is, of course, having. We know that getting kids back to school in one way or another would be a huge relief for parents who are trying to juggle work, but also overseeing homeschooling, especially for primary children. I mean, high school students have that level of independence which primary school children don't. But of course, this has to be managed in a safe way, because unlike other strains of COVID, Delta is affecting adolescents in a way that it wasn't before. It's infecting children in a way it wasn't before, and therefore we need to respond in a way that respects that. And of course, we'll follow the health advice. But as I said from the outset, our priority would always be getting kids back to school and getting people back to work. But what that looks like will be dependent on the next few weeks, how much we can control the case numbers until the end of August as to what life looks like in September and October. And we hope very much to be able to provide an indication to the community of what September and October looks like. And the reason why we will have some level of confidence in talking about that at the right time, it's a bit premature now, but in a few weeks we'll have a better idea as to what September and October looks like, because we will be able to see a consistent rate of vaccination. So we'll have a better idea as to whether hopefully we'll hit those 6 million target at the end of August, the 70% double dose vaccination target at the end of October. That will give us clear sight as to what September and October looks like. All of us want to provide as much certainty as possible. All of us want certainty, but we also have to be real and know that sometimes you have to wait for the health advice, because it does depend on what happens in the next few weeks. And that is up to us to make sure we all do the right thing in respecting the health orders and complying with them. And secondly, in getting vaccinated and making sure people in and around us get vaccinated. And that will be the strongest indication as to what September and October looks like. I'm sorry, I'll get to all of you. James, then Ursula, then Alex. Yeah. Well, the best advice I have that the vast majority of the backlog will be dealt with by the end of next Friday. That's the best update I have. Well, I'm just telling you the best advice I've had. I'm repeating to you the best advice I have. I've had a briefing from the people in charge of making these things happen, and the best advice they've given me is they anticipate the vast majority of the backlog will be done by the end of next week. But can I also stress that obviously 80 to 90% of applications are quite standard, but 10% of applications require a lot more work, and so we're obviously getting through that. Ursula, you're next. I'm sorry, you've had 3 questions. Ursula?
An outdoor playground in Bardwell Valley is a close contact site. Are there new concerns with transmission outdoors in outdoor settings?
I've not received advice on that yet, but we'll take that on board. Alex?
With vaccinated workers and trainees out of those ALJs going back to work, how satisfied are you that construction sites across the city are safe, and what's been done to address staff shortages giving the vaccine, particularly in southwest Sydney where people have been turned away from those countries?
Yeah, no, can I say I was concerned to learn about reports where people were keen to get the vaccine and yet they weren't able to achieve that when they turned up to the centres. So I've asked our team to look at more opportunities for walk-ins, for more opportunities for pop-ups in particular suburbs where there's high demand. The one encouraging takeout is when we've said to people, if you want to get back to work and you live in a community where there's a lot of the virus, please get vaccinated. People have responded positively, and it's not just the employers. We knew the employers were on board, but I've taken heart from the fact that people have responded to the incentive. They want to get back to work. So whereas someone may have been apathetic about whether or not they get the vaccine, the incentive to get back to work has really encouraged them, and I'm very pleased about that. But I also appreciate that we need to make sure that we have the processes and systems in place to accommodate all those people and those needs. So we're looking at making the booking system easier, we're looking at opportunities for top-ups, but we also say to people, if you're experiencing any type of delay or not sure about where to go, please also feel free to contact your local pharmacist, because chances are in the southwest and western Sydney that pharmacies are now providing vaccine. Your GP is likely to have vaccine. So please know there are a number of points of access, but of course we're doing what we can to also increase the points of access through New South Wales Health. And I think yesterday was the record, the highest day. I think we did over 30,000 in one day through our New South Wales Health site. So it's very encouraging that so many people are coming forward, but I apologise if anybody was turned away yesterday. That's the last thing we want. But the positive is the demand for vaccine now is growing and is high, and it's up to us to make sure we provide that opportunity for people.
Dr. Chan, just back to the playground. Last lockdown, playgrounds weren't taped off and kids couldn't play. Same with adult exercise in open parks. Is there any consideration doing that now, seeing you've got an exposure site in a playground?
Look, I don't know the circumstances of that exposure site. It may have been because the parents actually disclosed that the children played together as opposed to keeping separate. Obviously, we're trying to balance the fact that outdoor environments are generally safe, but you still need to keep away from people. In that area, you'd also be required, if they're in the affected areas, to wear a mask at all times outdoors, but obviously children can't. So it is about the fact that we do want people to go outside. Walking around and exercising is actually important for people's mental health, but we do need to do that safely. So if you're going to playgrounds, don't encourage the children to do that social thing of playing with the other children. Keep people separate. Try and go to playgrounds in other areas when you know they're not particularly busy. So I suppose it is a balancing act. All contact, close contact, is a risk, but we do want people to enjoy the outdoor environments. Sorry?
Childcare centres at the moment, how significant an issue?
Childcare centres, we are seeing a number of childcare centre outbreaks, and I think we've given advice that if you can keep your children home safely, please do so. We are seeing a number of cases in childcare centres, often introduced through the staff or the children, and the children can in many ways transmit between themselves. So we are seeing with this form of the virus more cases in childcare centres.
Last question, yesterday you told the inquiry that it wasn't appropriate to question Dr. Chan's advice. Given the level of lockdown, 7 weeks, 5.5 million people are locked down, do you maintain that? Do you think that people do have a right to understand better the health advice that's being given?
Absolutely. But what my concern was more that it was being exercised in a political way. The questions were loaded politically with not necessarily the logical outcome. They were drawing their own conclusions. Not all of them, but some of the questions were very good, but some of them were a little challenging in that front. I guess what I would say is that Dr. Chant works very hard, extremely hard, and so does a whole public health team. And I think challenging what I would see then as her integrity in terms of her decision making was not appropriate. That's what I was really saying. Sorry, can I just... Sorry, Chris, I'll come back to you. I'll come back to you. But, yeah, sorry, James.
The Deputy Commissioner said travelling from Sydney to Byron to inspect property is probably not reasonable, but under the health orders it's currently legal. What can you do to make it illegal if that's not something you want people to do?
Well, we talked about that yesterday and the day before, and we talked about the fact that there are circumstances where, for example, there's a marriage breakdown, somebody's going to look at a house for that situation, or perhaps the doctor works in maybe Byron Bay and works in Sydney. So those issues have to be balanced, like everything else in the epidemic. And we're doing that, but I've asked the lawyers to look if there's any other measures that... not at this point, no. Sorry, Alex. Oh, yeah, I'll come back to you, Chris. Sorry, Alex.
No formal process to nominate who you've permitted single bumper visitor is.
Sorry, Alex.
So there is no formal process, right, to nominate who your permitted single bumper public visitor is?
Well, as the Deputy Commissioner has said, this question's been asked a few times over a number of days. As the Deputy Commissioner has said, the police job is to be investigators. They do a very good job at that. They're trained investigators. And if somebody is if somebody is taking advantage of that situation, then I feel confident that, as the Deputy Commissioner said, they will get them.
How are they going to find out?
Sorry,
Chris.
Just on those MPs who are pushing up private members' bill. Are you concerned the message that sends to the community, given where we are right now, and should the members of your government be taking Kerry Chant's advice and go out and get vaccinated and encourage the community to?
Look, I think that one of the beauties of political parties is that you can bring matters up within the political party for discussion. That's the value of having a team. I was a little disappointed, to say the least, that it was aired in the public arena before it was aired within our party room. It's not something I would agree with. In fact, I'm completely opposed to the concept, and I think the members were advised of their colleagues' views on that, and I don't think they were left in any doubt that the majority of members were not in agreement with them. Thank you, everybody.
Last one, please.
You mentioned at the start of the press conference Bayside in the West Perth. Are those LGAs at risk of going to that part of lockdown that the others are? And you said on Sunday that George's River, you gave hope that George's River may come out and then some of that will happen.
Yeah, no, thank you for the question. Unfortunately, half of Georges River is doing well, but the other half that abuts the other local government areas has seen an uptick in the last few days in cases. So whilst we were feeling more confident about taking Georges River out, at this stage the health advice is we've got to stabilise further before that's considered. In relation to the other three local government areas I mentioned, Bayside, Inner West and what was the third one? Yeah, Burwood. Again, the suburbs adjoining the other local government areas of concern are showing an uptick. It's not the entire local government area, but notwithstanding that, health may very well say to government today or tomorrow, the next day, as a precaution, we want you to lock down. So they're not at a stage yet where they've taken off, but we want to prevent them from taking off, because interestingly, whilst again the most number of cases are coming out of Canterbury Bankstown, and we just want people not to give up there and to keep working hard, we have seen a stabilisation and slight decline in the last few days, which demonstrates a bit of a trend. So we're hopeful and really crossing our fingers that trend will continue, but then as a consequence you've seen it trickle over into adjoining or abutting local government areas. So we certainly at this stage want to make sure we contain the spread within the concentrated areas that it is, and take any precautionary action that we need to make sure that we get ahead of any likely uptick that might eventuate. But in those particular suburbs, Dr. Chant's advice to us is always, if your local government area is particularly being mentioned, if your suburb is being mentioned, please come forward and get tested. Please make sure you're taking that extra care. Please make sure you're not leaving your home. And if you are, you're assuming you've got the virus or that others do. As we said with Delta, the infectious period is starting much sooner, and sometimes without symptoms, which is scary, because it means that by the time symptoms develop and people get tested, they've already been infectious in the community. And that's why every time anybody leaves the house, not just in those areas but across the state, please assume you have the virus or somebody else you're in contact with does. Thanks everybody.
Thank you.